News anchor Christy Casciano, weeknights on ABC 50.
Things, but I just don't think it's going to have a big effect long term on your money. With your money in your pocket minute, I'm Rick Reagan.
Good to know, Rick. 5:30 about. We look here at the weather check, and we're talking about a beautiful looking view here with the Pompey camera, sun, some high clouds, low and mid 70s out there now. We fall back into the 40s, low 50s, comfortably cool. The way the windows may be cracked open as you snooze under a partly cloudy sky. Kids at the bus stop. Looks like a cool start. Very nice finish with a breeze, 70s. It's 5:30.
From WSYR TV Syracuse, the local station. You're watching News Channel 9 at 5:30.
Good evening. I'm Christy Casciano.
I'm Jeff Kulikowski, the police chief, with some strong words today after 4 people were killed, 8 others hurt at an attack at a chapel in Grand Blanc, Michigan.
The suspect was killed in a shootout with police. ABC's Rena Roy has more on the search for a motive of the attack.
An urgent investigation underway after this deadly attack in Michigan.
We have lots of questions. How could this happen? What created this moment? Why?
Authorities say 40-year-old Thomas Jacob Sanford, a Marine and Iraq War veteran, rammed his truck into the Church of Jesus Christ of Latter-day Saints in the township of Grand Blanc just before 10:30 a.m. Sunday, then opened fire with an assault rifle and set the building on fire. Improvised explosive devices also found at the scene. The ATF now looking at those devices as investigators try to piece together the clues. The church a total loss.
Our church is gone. I joined the church 38 years ago. To see somebody would do this to my church.
Hundreds of congregants inside for Sunday service as the attack unfolded, some jumping in to help.
Those on the scene were absolute heroes, going in and out of the fire to drag people out, helping each other take care of the victims on the scene.
4 people dead, 8 others injured. The suspect killed in a shootout with police. The FBI calling this a targeted act of violence, but saying the motive is still unclear.
Evil. This was an evil act of violence.
President Trump over the weekend writing on social media calling for the, quote, epidemic of violence in our country to end. White House Press Secretary Carolyn Leavitt speaking on Fox News today.
Based on my conversations with the FBI director, all they know right now is this was an individual who hated people of the Mormon faith.
The governor urging people to avoid speculation as this investigation continues.
Speculation is unhelpful and it can be downright dangerous. So just ask that people lower the temperature of rhetoric.
The FBI is leading this investigation, saying that agents worked through the night, following up on more than 100 leads from members of the public. Rena Roy, ABC News, New York.
Checking our top stories tonight, new details about the deadly shooting at the Mattydale Express convenience store in Salina. Sheriff's deputies telling us today 31-year-old Ahmad El Harbi, the owner of the store, was confronting a man trying to steal nitrous canisters just before noon on Sunday. During the confrontation, they say 30-year-old Alec Greger of Salina shot El Harbi multiple times. He died at the hospital. Police tracked Greger, they say, to his home, and while trying to get him out to come out peacefully, they say he shot and killed himself.
Syracuse Mayor Ben Walsh says that suspicious package that caused City Hall to be evacuated was a listening device. It was part of the I-81 project. Right around noon today, City Hall was evacuated. Streets were blocked off. People were told to avoid the area. After an investigation, the mayor says it was a device that was put there by a DOT contractor. A health alert with the detection of low levels of measles virus in a wastewater sample from parts of the city of Oswego and surrounding areas.
Samples collected early last week. It's one of the topics we have for the Onondaga County Health Commissioner.
Right.
Dr. Katie Anderson, good to see you. Thanks for joining us. Appreciate it.
Thanks for having me.
I know it is not your county where where that wastewater came from, but let's talk a little more broadly, I guess, about it. What's the level of concern? Because when we hear measles, I think people's antennas really go up.
So let's start by placing this in broader context. So currently in the United States, we're having the worst outbreak of measles we've had in decades. There's been over 1,500 cases involving over 40 states, and there's been over 20 cases in New York this year. So unfortunately, going into this finding in the wastewater, measles is entirely preventable, but given levels of vaccination, it's not just a matter of if, it's when we would begin to see this. So the level of concern should be high. Measles is a very serious and preventable disease. The finding of the measles in the wastewater We'll have to see what that will tell us. It could be an early indication that there may be just one person infected, there may be multiple people infected, but it's another indication that we need to keep our level of vigilance quite high and get people vaccinated as quickly as we can.
Yeah, I was just going to say, does that put Onondaga County on a higher alert now that it's right next door in Oswego County?
We were on high alert, and now we remain on high alert with increased vigilance. So our last case in central New York was in Onondaga County, I believe in the year 2000. We're fortunate in this region of the state that our levels of vaccination are higher than some other regions, about 89%, but that's still not high enough to completely eliminate the risk of a measles outbreak. So we remain on high alert.
25 years ago was the last case here. Wow. I was asked by a couple people about this. Would there be any reason for somebody to get a measles shot? I know there's no real such thing as a booster, but if they don't know their vaccination status, I'm thinking probably adults who are a little bit older and maybe don't have access to that kind of stuff.
Yeah, so measles is highly contagious. So the guidance is that if you were born before 1957, which is about when the vaccines began to roll out, you were almost certainly exposed and you can be considered immune. If you were born between 1957 and 1968, there were some vaccines that weren't as good as this current vaccine at that time. And so your recommendation is if you got the killed version of the vaccine, you should get another dose of MMR. For everyone else, if you've gotten your vaccine, there's no need for later in life boosters. It's a great vaccine that works for decades.
Okay, that's good to know. You know, we talk about the measles vaccine, and we know that it's a key CDC committee a couple of weeks ago changed the childhood vaccine schedule for MMRV. What's your recommendation about getting them all at once, as has always been scheduled?
So the meeting of the ACIP, or the Advisory Council on Immunization Practices, has raised some confusion and I'd say some concern about potentially changing recommendations coming out of that council. But what I will say, and it's important that people hear this, is that the recommendations from your state and local health departments, the recommendations from professional associations like American Medical Association, American Academy of Pediatrics, have not changed. The recommended vaccines by age, by different indications, are the same as they were. In that meeting, ACIP met and discussed a few vaccines. MMRV and COVID are the main ones that came out with recommendations. In that meeting for MMRV, which is a combination vaccine of measles, mumps, rubella, and varicella combined to decrease the number of shots kids are getting, they flagged what they saw as a very small increase in a non-serious condition, which is febrile seizures. And they used that as the reason to say that children under 4 should not be recommended to get that vaccine. Now, practically, the implications of that may not be significant. However, it does decrease patient choice, provider choice. Both of the vaccines given separately are still good. We still recommend everyone gets them, but it's counter to evidence and science-backed recommendations.
I've been meaning, I'm going to change topics now. We're going to get off vaccines a little bit. I've been meaning to ask you this one since I think about August. We're finally going to get to it. You have formalized a partnership between your current employer, the county health department, and your former employer, SUNY Upstate. What is that all about? How'd that come together, and why? Why are we doing this?
So we are very excited about formalizing this partnership, and it's built on multiple areas where we already collaborate together. So around COVID, around tick-borne diseases, training in the medical examiner's office. But it's modeled after successful partnerships, for example, between Harvard and the Massachusetts Department of Health, Albany and the New York State DOH, to build a scaffolding around these institutions, borrow from both of our strengths, and really try to improve the impact of our health-related interventions, public health in our community.
Can you give some examples of how you think the community will mostly benefit from this new partnership collaboration?
In a couple ways. So, and this has been, again, demonstrated in multiple similar partnerships. Local preparedness is a big one. So we bring together our different strengths in healthcare and in public health, and God forbid the next avian flu or measles outbreak comes, and we're prepared to pivot and borrow into applied research and grow from there. Another example would be EEE. Unfortunately, we have reliably EEE detected in our county every year, and there's a lot we need to learn. So borrowing from their research capability and our applied public health, we can learn a lot.
Last one for you on it. The benefits to the county in Upstate, is it the idea of we kind of maximize our resources, we're not duplicating efforts, we're kind of rowing in the same direction here, so to speak?
Yeah, so we have overlapping but somewhat distinct perspectives, right? So Upstate is our safety net hospital for the region, but with a lot of research expertise. We have a clear applied public health mission, mandated mission in some areas at the county, and so it brings us together to hopefully implement programs that are more impactful and innovative. So again, the research into mosquito-borne diseases would be one example of that. But we also hope to recruit attract and retain talent to our area, which would improve outcomes for upstate, for the county, and for our community as well.
A lot of opportunity there. Dr. Katie Anderson, thank you so much for your time, and as always, your guidance. We appreciate it.
Thank you.
Thanks, Katie. We have more local news coming your way tonight at 6 o'clock. We're digging into some of your questions about those inflation refund checks being mailed out by the state.
And temperatures will stay on the warm side for tomorrow, but beyond tomorrow, some changes take place. Some fall-like changes. We'll let you know about those changes if we see any rain in our forecast in the near future. Coming up after the break.
You're watching News Channel 9 at 5:30 with Christy Casciano, Jeff Kulikowski, Storm Team Chief Meteorologist Jim Teskey, with Central New York's most accurate forecast. News Channel 9, the local station.